Oh. What is staphylococcal infection? Staphylococcal is a grape-like clusters of gram-positive bacteria that cause a tremendous number of infections in nearly every human body system. Staphylococcus aureus, vancomycin resistant, becomes serious in nosocomial infections. Staphylococcus epidermis and hominis are commonly seen on the skin. Staphylococcus ticus is seen in the anal area, genitals, nose, and mouth. How is staph infection transmitted? It's commonly transmitted through hand-to-hand contact during patient care, but can also be transmitted through airborne transmission. What are some signs and symptoms? Each type of infection is seen on different parts of the body. Many staph infections begin as a small lesion similar to a pimple, mosquito bite, recent injury or abrasion, or from surgery. The wound quickly enlarges and becomes inflamed and quite painful. Athletes may run a low-grade fever that progresses to a higher temperature as their body fights infection. Staph infection hominis causes no known diseases, and Staphylococcus typically causes a urinary tract infection. Who is affected? Anyone can develop a staph infection, but people that are at a greater risk include those with chronic conditions such as diabetes, cancer, vascular disease, eczema, and lung disease. In healthcare settings, the risk is more serious due to the increased population of immunocompromised patients. In athletics, the biggest culprits are those associated with skin wounds and post-surgical infections. How can you diagnose a staph infection? A patient with a wound showing signs and symptoms of infection such as heat, swelling, redness, and pain should be referred to a physician. Wounds that rapidly deteriorate or become enlarged should also be referred. Gram stain and cultures of the infected material can help make the diagnosis. How is staph infections treated? If the infection is detected and the patient is referred early enough, a physician may be able to drain the infection and prevent further problems. Antibiotics are given based on severity of the infection and local resistance patterns. If the athlete is a staph carrier or has a history of resistance to penicillin treatment, other medications may be required to eradicate the infection. How can you prevent staph infection? Any healthcare member or person coming into contact with open wounds should wash their hands and under their fingernails vigorously with soap and water. People who prepare food should always be washing their hands and nails. Do not prepare food if you have a nose infection, eye infection, or wounds and skin infections on the hands and wrists. What are some stats and fun facts about staph infection? 5% of all cases are fatal. 25 to 30% of the population is colonized with staph. Staph infections account for 1 out of every 5 hospital-contracted infection that occurs. Staphylococcus aureus is a type of bacteria that is about 30% of people carry in their noses. That's staph infection for you.